The fight response, if your dominating strategy was to fight, then as an adult, you might feel self-preservation is what counts at all costs. You might have a short temper. You might have an explosive temper. You might be prone to outbursts, emotional highs and lows. You may be aggressive. You may have angry behavior. You may feel the need to control others. It may be difficult for you to hear other people's points of view. You might feel a sense of entitlement. You might have a demand of perfection from others. And I know a lot of you are probably thinking, oh, that sounds like a narcissist. But see, that's the thing. People with the fight response can sometimes typically be labeled as narcissists, sociopaths, or have some kind of conduct disorder. And I find this to be so true in people that were children of narcissists that had that fight response and they have that strong personality. And sometimes they'll say, maybe I'm the narcissist. Hopefully, this information will help you to realize that, first of all, the fact that you're contemplating that you're a narcissist usually means that you're not a narcissist, but it may be that you are stuck in this trauma response, okay? So the next trauma response, the flight, some characteristics of people that have the dominating flight response, they can be obsessive and compulsive. They may deal with feelings of panic, anxiety. They might always be rushing around, almost like in a rush to stay busy to outrun pain. They might over-worry, be workaholics, can't be still, they can't relax. Sometimes they micromanage situations or people. They're always on the go, they're always doing things and want things to be perfect, and they can be overachievers. And sometimes somebody that is stuck in a flight response can typically be mislabeled as having OCD, be bipolar, ADHD, have panic disorder, or a mood disorder. Okay, the next response is the freeze response. When triggered, people that are stuck in the freeze response, they might space out. They might have feelings of being unreal. It's like they're hibernating at times, isolating themselves from the outside world. Sometimes they can be couch potatoes. They may dissociate, have brain fog, difficulties making decisions, acting on their decisions. They may be achievement phobics, want to hide from the world, and feel dead and lifeless inside. Sometimes they can be mislabeled as being clinically depressed, schizophrenic, have ADD or DID, dissociative identity disorder. And then finally, there's the fawn response. In the fawn response, people that are dominated by the fawn response are usually people pleasers. They're scared to say what they really think. They talk about others instead of themselves. So in conversations, they're usually asking the other person questions and getting the other person to talk, so that the focus is not on them but on the other person. They flatter other people to avoid conflict. They're like the angel of Mary, the one that they always feel they have to be happy and up and upbeat. They're overcaring. People can view them sometimes as a sucker. They can't stand up for themselves and say no, so there's very limited boundaries there. They're easily exploited by others. They're hugely concerned with their social standing and acceptance, fitting in at all costs. They are the yes person, the person that someone will say, oh, just ask so-and-so. They will always say yes. They will never say no. That would be somebody that was dominated by the fawn response.